Can I ask you also what you would tell a patient who's having problems? Maybe they're having some symptoms that are related to their cancer or they're not feeling well. What would you recommend to those patients?
It's very important to plug into the team. A metastatic breast cancer patient, outside of their core cancer team, they're usually attached to a palliative care team. And that palliative care team will include a pain specialist. It may include a GI specialist, which is a gastroenterologist, and that will help with any disorders of the stomach, gut, or any nausea that may be involving the speech therapist, any swallowing difficulty. It may also involve the neurologist, because if the cancer has spread to the brain and they're experiencing some difficulty, maybe they have a lot of numbness and changes in their fingers and their feet, they may see the neurologist. So it's very important that they plug into these specialists within their core external team, because that is how their symptoms are being managed. And everyone is around that patient, making sure that the patient has that multidisciplinary care. And sometimes I may serve as the conduit, because they may tell me what's going on and I inform the rest of the team. So it's important that we all on the same page. And that's how communication is the key, and that's how the patient can get the best care.
So the patient has to let us know how they're feeling. They have to let us know what help they need, and then we can make things happen.
And that's important, that we know who their team is. And it's hard when a patient is seeing a provider here, a provider there, and the providers are not communicating. Often I've seen a patient where they have a recurrence and it's stage 4 disease, and there was a lag in their care, maybe 12 months, 18 months, because they have seen a provider outside of their team. And while they're working up their bone pain for musculoskeletal injury, if they were with their cancer team, we would immediately go to looking for metastatic workup, looking at a PET scan, and we would have been able to be a little bit more aggressive. So it's very important when symptoms occur, a patient, even a patient with early stage breast cancer, when symptoms occur, it's very important that they plug into their cancer team, because their primary care provider may not be aware of some of the symptoms that they may have, may be related to their cancer. So it's very important to keep your cancer team in the loop at all times.